Hi, I'm Dr. Kevin Baiko. I'm the physician founder of Hawaii Compassionate Care, a medical practice based in Hawaii specializing in cannabinoid medicine. It's a subject which I've learned a great deal since this picture was taken back in 2010. As you can see, my wife Michelle has been helping me run this business since the beginning. By the way, I'm also a medical director of the North Carolina Cannabis Patients Network, as well as a board member of the American Academy of Cannabinoid Medicine. Obviously, I cover a lot of ground, so let's get started. These days, more and more people are becoming aware of the amazing medicinal properties of cannabis. Over half the states in the USA have passed legislation to allow qualifying patients access to this herb for medical use for such conditions as cancer, HIV, glaucoma, PTSD, chronic pain, nausea, muscle spasms, seizures, appetite disorders, and the list goes on. But what makes cannabis a medicine? The herb has certainly been used as a medicine since ancient and probably prehistoric times. The earliest written reference describing the use of hemp to treat pain and inflammation is the Chinese Raya, dating to 1500 BC. Evidence exists of its use to treat pain and inflammation in ancient Egyptian, Indian, Greek, Roman, and Islamic pharmacopoeias. Credit is generally given to Irish physician William O'Shaughnessy for introducing cannabis into Western medicine in the 1830s, following which time it enjoyed increasingly widespread mainstream medical use until prohibited in 1937 over objections from the American Medical Association, amongst others. In 1964, its most notorious ingredient, delta-9 tetrahydrocannabinol, or THC, was discovered. Of course, THC is the key ingredient to the high cannabis is both famous and infamous for, but one of over 60 related compounds called cannabinoids, along with other more common terpenes. In practice, they're more medically effective together than as isolated agents. This might explain why dronabinol, a synthetic version of THC, approved as a Schedule II drug in 1986, then as a Schedule III drug in 1999, is both less effective and more unpleasant than its unrefined herbal counterpart. It wasn't until 1988 that chemical receptors responding to cannabinoids were discovered in the human body. And it is perhaps worth mentioning that all vertebrate animals, including fish, amphibians, reptiles, birds, and mammals, have these receptors distributed throughout the body, and most especially in the brain. In fact, the most prevalent of these receptors, the CB1 receptor, is one of the most common receptors within the central nervous system. Just check out this rat brain. The lit up areas show where CB1 receptors are concentrated. It's also worth noting the lack of receptors in the brainstem, the area governing basic life functions like breathing, swallowing, heart rate, blood pressure, and consciousness. And this might in part explain why cannabis is very safe as medicines go. Nobody has ever died from cannabis overdose. Now, whenever people ask me about some article they read citing a particular danger cannabis poses, I find it helpful to ask in response, compared to what? Taken out of context, any substance can be demonized. Now, it's estimated that animals developed cannabinoid receptors long before the cannabis plant was even present on the planet. So why do we have receptors? Well, if you're not already there, I'll tell you. We synthesize our own activators of cannabinoid receptors in our bodies, and we call them endocannabinoids. They own the distinction of being the first known lipid-based transmitters. The two best-known endocannabinoids, arachidonyl glycerol and anandamide, were both discovered in 1992. The primary function of this endocannabinoid system, comprised of endocannabinoids and their receptors, seems to be the maintenance of cell homeostasis. In other words, endocannabinoid synthesis is an adaptive response to cellular stress aimed to maintain and establish balanced cell function. Now, it does this in a number of ways, and it's kind of complicated, and much remains to be learned yet. But one of the most fascinating ways happens at the junctions of nerves called synapses. Nerves communicate with one another at an extracellular space called the synapse. When a nerve, which we'll call the presynaptic nerve, receives the sufficient signal, its electrical impulse causes the release of neurotransmitters, pictured here as red dots traveling downward, into the synapse, which they cross to find a corresponding receptor on another nerve, which we'll call the postsynaptic nerve. Whether the signal is excitatory, as when glutamate is the neurotransmitter, or inhibitory, as with GABA, Their detection on postsynaptic nerve receptors leads to the release of the endocannabinoid 2-arachidonylglycerol, or 2-AG, pictured here as green dots traveling upward. On demand from the lipids in the cell membrane into the synaptic space to travel in a retrograde fashion relative to the nerve impulse until they find a CB1 receptor on the presynaptic nerve. The signaled CB1 receptors then suppress the neurotransmitter release and signal, and the 2-AG is rapidly degraded. And so the presynaptic nerve is informed by the presence of 2-AG that it can reset as its message has been received. This is known as negative feedback. In other words, the endocannabinoid system helps keep the nervous system calm, fine-tuned, and operating at maximum efficiency. It's worth mentioning that stress hormones lead to a decrease in the expression of CB1 receptors on presynaptic membranes. And this makes sense in terms of survival because you don't really want a relaxed nervous system if actual threat is imminent. Problem is, rarely is actual threat actually imminent. So chronic stress leads to a suppression of the endocannabinoid system and its homeostatic capacity, setting the stage for chronic degenerative changes and disease. What happens when we supplement our endocannabinoid system with cannabis? First off, as a plant with a wide variety of genetic expression in terms of cannabinoids and terpenes present, its effects can vary greatly depending on sample source, quantity used, and method of delivery. But generally speaking, plant-based cannabinoids supplement the homeostatic contributions of the endocannabinoid system. The nervous and immune systems relax, while the stress response, along with the perception of pain, spasms, and a host of other cellular stress-related symptoms, is downregulated. So their effects are usually advantageous to well-being. Does cannabis use disrupt proper functioning of the endocannabinoid system? Generally speaking, this is not the case. It's certainly possible to overdose, especially with edibles and concentrates, and this can lead to side effects which, while unpleasant, are never life-threatening. Certainly, heavy and chronic use of cannabis can lead to tolerance, requiring increased cannabinoid intake to achieve the same effect. But such tolerance is not to be mistaken for addiction. Cannabis use might be habit-forming, but then again, so is playing on our computers and phones. And generally, a day or two of cannabis abstinence weekly proves a remedy to tolerance. Experience has taught me that less is often more when it comes to cannabis use as a medicine. Thank you.
It's safer than cocaine and heroin too. Safer than methamphetamine. It's safer than aspirin, acetaminophen, hydrocodone, oxycodone, methadone, morphine. It's safer than vaccines, fluoride and caffeine, high fructose corn syrup, aspartame. It's safer than alcohol, beer and tobacco, and puking sugar from Hawaii.